Hi there. I just want to talk about care of the elderly, especially obviously osteopathic care, because that's where I'm coming from. The elderly, there's obviously an increasing elderly population because we're living longer. We're living a lot longer in the last 20, 30 years. Longevity has gone up massively. And so there's a greater population of the elderly, but they're being faced and they're having to handle certain conditions and issues. And I just want to start to talk about these issues a little bit because it's what I see in practice. And I think I've just started to think about this in the last few weeks, actually, that there is this vital time, and I've seen it quite a lot in my practice very recently, and that's why I wanted to talk about it, which I call a vital time, which is a transitional time. So what happens is, for example, just giving an example, an elderly person has a fall, they maybe break something, they spend some time in hospital, then they spend some time in respite care. Now, this is the transitional time where it's important. This could be true of having kidney infections or a fall or whatever, any of these kind of issues that can cover them, or a chest problems or pneumonia or anything like this. So they come out of hospital, going to respite care. Now there's a choice that happens here. This is a really important thing, when either they can go back into their home environment or they spend more time in care. This subject interests me because actually as I was studying osteopathy, and when I was from a youth from 16 years old, I worked actually as a nurse, a kind of grade A geriatric nurse in nursing homes and hospitals. And I don't know why, I really had an affinity and really enjoyed working with old people. And there was always this kind of transitional time. And I just used to watch different processes that were happening within that care of the elderly. And so it's been a subject that's been with me for a long time. So you have whatever it is, a fall or a kidney infection or whatever, you hurt your back or something like this, and there's a point by which the family have to, or the person themselves have to, decide whether they're fit or strong and able, or those around them decide whether they're fit and able to go back into their homes. And for me, this is a really vital time. I've been doing this a little bit, I've been trying to do this a little bit in my practice recently, where people have brought the patient in from the hospital or the respite care into my practice, and I've treated them, I've helped support whatever was going on with them, be it if they had a kidney infection or that if their back was completely shut down or whatever was going on. Allowed them to balance out, get a little bit of vitality and strength back into their system, which would allow them, hopefully, to go back into their own homes. So without that kind of support, some sort of care and support, because you've been in hospital and you've been taking a lot of drugs, and the system, the immune system and all of the different systems, the musculoskeletal system, some of the organ systems are fatigued, under distress. A plethora of medications can weaken and have different side effects on the body, and all of these things really need to be supported and dealt with. And I think it's really important that actually when we do that, people can come back to their strengths, or they can go downhill. It's like, which direction do we go from here? And so there are a lot of other conditions and issues that we have to talk about in terms when we're dealing with the elderly, because let's talk about the musculoskeletal system first of all. Wear and tear on the joints, osteoarthritis, osteoporosis, which is decalcification almost of the bones. So the bones themselves get weak and can be prone to fracture, or osteopenia, which is a lesser version of that. But because of the bone structure is weakening, the muscles weakening, coordination weakens, and the joint capsules and fluids themselves are becoming less functioning, there is obviously this a difficulty in mobility. Mobility is key when you're older, because actually the more mobile you are, the more independent you are. If you lose your mobility, you lose your independence, and that is absolutely vital. So I spend a lot of my time working with old people, actually keeping the joints free. It's like they almost need oiling as you get older. sort out bits of pains, because actually, arthritis, a knee that's arthritic can be painful, lack of movement, lack of function, the lumbar spines really lock up as you get older. It's a life of working and walking. It's not surprising that there's wear and tear. But for me, it's like I always say, it just needs a little bit of oiling, and we need to just free everything up just in a very gentle, supportive way. And the goal of that is to maintain mobility and function, simply. And I think it's a huge area, and we should be doing it with everybody, actually. Another area which is important, and I've just started working on, is to do with cognitive decline. And I've just started in the last few years to work specifically with supporting the blood supplies to certain parts of the nervous system and seeing if that helps. Sometimes it can be helpful, I'm not sure, but it's something I will try and I'll work with, and I can't say that it's foolproof, but certainly in some cases it seems to be supportive. It's a big area, and hopefully my skill base will increase as I do more of it, and I've been doing it for a long time now. Bladder and bowel function obviously diminishes. The nerve supply gets cut down. It's like also in a child or a baby, sometimes there is diminished blood supply to the bladder, and you get enuresis nocturia, and sometimes it's a matter of switching on the nerves a little bit, helping support that, freeing up blocks in the pelvic and the spine, which can actually strengthen up, because the nerve supply to the bladder and bowels come from the spine, and if there's wear and tear and weakness in the spine, it can affect the nerve supply. It's almost like putting a dimmer switch on a nerve. Nerves are electric. Which we talked about this kind of transitional or this vital time, but post-hospital recovery is very important, because when someone comes out of hospital, if they've had surgery, etc., surgery leaves scarring internally and tightens everything up, and it can weaken certain other areas. It's very simple, just to keep the body in balance, keep the fluids moving in the body, improves vitality and post-surgical recovery. I think it's very important. This is a big subject, and there's many different things we can talk about, but the one thing I want to come back to, which is something I think I'm going to come back to more and more, because it's just something that I'm dealing with more and more, is anxiety. I think I'm doing a book, The Dynamics of Stillness, now, but the next book I'm going to do is going to be an audio book, which is going to be about the physiology of anxiety, and I'm going to use some specific techniques which I use with people, which are kind of contemplation, meditation practices, which are directly for working with anxiety states. It's a process, and it takes quite a long time to explain, but it builds. And so I'm going to do that as an audiobook, hopefully later on this year, 2018. Anyways, anxiety as you get older. There's obviously certain emotional factors as you get older which can cause anxiety. The most obvious is the approach of death. Also seeing friends, family dying. Grief can trigger anxiety very much in elderly people. A lack of control, all these huge emotional issues. This whole idea of independence and losing independence, and also purpose. Understanding purpose is so, it's difficult. And I remember my nan, who died actually a few years ago at 95. In the last few years of her life, she wrote a book, really, just for herself, about her story and her history. And I think what was really important about that was for her and for people to understand their purpose and the meaning of their lives. And I think that can put it into context. And I think it's something I would always encourage, is people to almost catalogue their lives. I think that's important in seeking a place of understanding, because the simple thing, as you get older, you lose control. of your life. You feel like also you're an emotional bind on those around you, families, friends, a financial burden if you're going towards nursing homes. But actually, I think this is wrong. The culture has got this wrong, and I think old people need to be supported because that's where we came from, and they are the wisdom and they're the history of us. And working with some specific techniques to help with anxiety, calming down. When I'm working with anxiety in elderly people, I'm calming down, trying to calm down physically their nervous systems, which seems to be helpful in places. But I think support and understanding, communication, and all these things it's such a huge area with elderly, and one of the biggest issues, I think. I mean, there's lots more areas when you're working with elderly, and we could, I could run a whole course on the treatment and care of elderly people, but it's huge. And anyway, that's a little bit of an introduction.